Part 2. Thank you for joining us for this webinar series. Today we're going to focus on changing the environment to address tobacco. My name's Jill Williams. I'm a professor of psychiatry at Rutgers Robert Wood Johnson Medical School in New Jersey. I also serve as the medical director for the NYC TCTTAC program, which you may be familiar with. This is a project funded by the Department of Health, Bureau of Mental Health, in partnership with the Center for Practice Innovations, or CPI, at Columbia. And you may know my colleagues who are also on the webinar today. So I have nothing here to disclose. And as you may be aware, the TCTTAC project is really involved in helping cities within New York, programs within New York City to develop best practices around addressing tobacco. So our learning objectives for today are to understand the importance of changing the environment and how that fits into an overall plan for addressing tobacco use within our program. Changing the environment can be a really successful part of an overall strategy and have many advantages, and also support the work that you may be doing in addressing tobacco use through your treatment innovations. So there's lots of benefits to changing the environment, which really support the treatment environment and also help to increase the demand for tobacco treatment services. So it's really part of a continuum when we think about this problem of addressing tobacco in our settings. So why focus in on the environment? Well, certainly similar as we saw to the policy interventions, these are often interventions that can have broad impact that will really impact all populations you serve. So it's a way to kind of make sweeping change and reach many people with your intervention. Certainly, this is an evidence-based approach. We know that the techniques and tools that I'm going to talk about today have been studied. They're effective, and they're often cost-effective and not that costly to implement. When we change the environment, we help to change the norms and social acceptability around tobacco, which is an important idea, which may be new for some of our settings. Anything that makes it more difficult to use tobacco reduces the uptake in young people, so fewer young people will start, and hopefully older smokers will also be more motivated to think about quitting. So these interventions increase cessation, and they also can have a prevention-like effect. So how do we think about doing this? Well, again, we focused on policy on Tuesday, and policy and environment are kind of a continuum. So there's a little bit of overlap when talking about these topics. Policies, of course, can be a part of changing the environment, restricting access to tobacco by having reduced smoking areas, limiting space or access to tobacco. Certainly in the public health arena, we know that through price and taxation, that's another way to restrict access to tobacco. What we're going to focus on a little bit more today is really environmental interventions, which counter the advertising message of the tobacco industry. To me, this stuff is really fun to talk about because this is how we can really get our message across to populations through education, messaging, campaigns, and all the different techniques that we have to communicate with people in our settings. Not only direct communication, but technology, how we influence and get the message out to important stakeholders. So this is kind of a fun and can be a really creative topic in thinking about how to really get the word out and to shape your message. Addressing the environment, of course, is part of our overall plan that I mentioned on Tuesday. And you can be doing a self-assessment of your program if you like, which is a really nice tool that we developed, the TISET, which allows your program to do a self-evaluation to sort of understand where you're at today in terms of working on some of these issues and implementing tobacco treatment. And you can see dealing with the environment is one of the key domains that we focus on in our overall approach. You can use the information from that self-assessment to develop an implementation plan, which really helps to highlight the strengths of your program, some of the things that you may have already in place, as well as some things that you might like to prioritize to work on to even strengthen your interventions beyond what you're doing today. We have documents at each step along the way, or tools that will help you to do this work. And with your implementation plan, if you decide to focus, say, on changing the environment, a lot of the things I'm going to talk about today are also included in this Treating Tobacco Roadmap, which also gives you suggestions and tools for moving your initiative forward. Okay, so when we're really focusing on the environment, what we're talking about is making information visible in the program environment as a way to address tobacco, to reach more people, to really reinforce this message of wellness and that we address tobacco. We feel it's important here in this program. Again, policy can be a piece of that. And the environmental or communication aspect in particular can be the communication. How do we communicate these changes or policy changes to staff, to our recipients of services? How do we let visitors know that we're having these changes? What kind of materials might we want to develop? Signs, other kinds of tools so that everyone is aware, perhaps, that we're implementing policy change. But there's a whole rich repository of things that you could think about, resources like brochures, posters, all of these things that supplement our treatment activities and give people information about smoking and maybe even direct them to resources. So this really is sort of the information campaign. And of course, one of the key goals here is trying to change the norms around tobacco use. So if you grew up in the 60s and 70s like I did, right, we were exposed to all kinds of tobacco industry marketing. Certainly some of these things are continued today, but this kind of specific example that I'm showing here, targeted advertising to children, hopefully is no longer available in our communities. This is one of the things that was banned by the Master Settlement Agreement. And we know that by sort of banning this targeted advertising towards children, or at least trying to, helps to change the norms around tobacco use. And so for decades in this country, we've had these education campaigns, media campaigns to try and combat the message of the tobacco industry. So I'll just show you lots of examples as we go through this. There's lots of ways of thinking about disseminating information and changing the norms around tobacco. Now that we know that tobacco rates are so low in this country, they're really at an all-time low. Estimates around only 14% of the US population smoke cigarettes. We know that rates are much higher in these subpopulations or disparity populations or disadvantaged populations. So not everyone has benefited from these effective tobacco control public health strategies. And now there's much more smoking in LGBT populations, in people with behavioral health conditions. We know that there's been lots of targeted advertising to certain minority neighborhoods. And so we really can think about smoking being much more concentrated in these disadvantaged populations, and therefore really as a social justice issue. So whatever we can do to get our message out, any of these messages can be acceptable as a way to get people's interest and have them think about it. And, is our population really being exploited preferentially by the tobacco industry, and what do we want to do about that? SAMHSA, of course, is the branch of the federal government that provides a lot of funding to the states for the delivery of behavioral health services. And SAMHSA has really stepped up in recent years in terms of their messaging around this idea of tobacco, really encouraging all of us to include tobacco into our usual work, to integrate it into the other work that we do. One example of that is that SAMHSA is now adopting this idea of being ATOD. All of us in our work should be ATOD, which means that in addition to other services, we incorporate treatment for alcohol, tobacco, and other drugs. And it's important that the tobacco is really included there explicitly, or it otherwise gets forgotten. So again, changing the norms, it may be just something as simple as including the T in our policy, in our mission statements, and other work that we do. Just by including the T for tobacco, again, we begin to sort of change our own behavior recognize that this is an important problem and change the norms around tobacco use. Another idea would be to think about tobacco as a co-occurring disorder. Certainly work in co-occurring disorders is not new. This has been recognized for decades that, many here in this graph, 8.4 million Americans suffer both a substance use disorder and a mental illness. And in these kinds of calculations in the past, we have not included tobacco addiction as an addiction that people with mental illness experience. But I think it's interesting to rethink that. It is a co-occurring disorder. We should treat it like a co-occurring disorder. And again, changing the norms around the way we do business and the way we include tobacco in our language and treat it like other substance use disorders. So I said that policy is one example of changing the environment. I'll briefly talk about policy because I know we covered most of this on Tuesday, but policies are a highly effective way to change smoking behavior, and they have numerous ways that they interact with people and numerous benefits. They improve air quality and health by limiting, of course, smoking indoors. They help to protect non-smokers from exposure to deadly secondhand smoke. Anything that makes it harder for smokers to use their drug will help to motivate some people to try to quit. These policies that restrict smoking, especially in public places, will help prevent the initiation of tobacco use by young people. These are really supported by various public measures and public funding and public health initiatives. It's important to think about extending your policy or even rewriting it or adapting it to include electronic cigarettes. So maybe revisiting that if that's something that you haven't done to sort of update your policy so it really includes some of the most recent kinds of products that are available, since this is an ever-changing market. And again, you want to think about how does your policy impact the inside, but how does it also impact the outside or the so-called grounds of your facility? And how do we incorporate these kinds of policies in behavioral health settings? We know that they've already been widely adapted for public places, for recreational spaces, for other healthcare facilities. How do we really take the last step of including them systematically in behavioral health treatment facilities? It's important, of course, to reduce people's access to environmental tobacco smoke, which is a known carcinogen. People die every year. Estimates are about 50,000 people die every year from exposure to other people's smoke. They die from cancer and lung disease and heart disease because of exposure to other people's smoke. Children in smoking environments have a higher risk for diseases like respiratory diseases, ear infections, sudden infant death syndrome, and asthma. And we now know that pets can actually get diseases from exposure to secondhand smoke. So are we doing enough to really restrict access to environmental tobacco smoke, whether that's in the workplace, during a home visit, or even educating people about reducing the risk to other people that they live with? In thinking about policy language, it's always better to go with language that defines everything as tobacco-free as opposed to smoke-free, because you would want your policy to be most inclusive, include all forms of tobacco. In fact, your policy can even have a statement that says, we define tobacco as, and then you can include all the different kinds of products that you want your policy to include, like e-cigarettes or even paraphernalia. When we talk about tobacco-free, we're talking about no smoking in the buildings, but also on the physical grounds, typically in the vehicles that may be owned by the agency. And these policies often apply both to the staff as well as the clients. Places that have implemented these policies have reported numerous advantages of this, even when they were initially skeptical that it couldn't be done, or that it would be too difficult, or that it would adversely affect the patients. Those things seem to not be true. That in retrospect, the employees often report that it's a better place to work, it's cleaner, the health of the patients is improved, there's fewer incidents in terms of people bartering about cigarettes, leaving more time to provide treatment. So many advantages when places have gone through these transformation processes of implementing this kind of policy. We talked briefly about this idea that even if you're not able to do completely tobacco-free policy, that there's lots of other examples of policy changes that you can take that either restrict smoking in the environment or maybe segregate smoking between staff and clients. Okay, if we really want to focus in on the physical campus, that's a big part of the environmental change. It's not the only part, but really considering the space and the physical campus is an important part here. And it may require you to first sort of survey your area, fully understand the areas where people smoke. You may want to think about even cleaning certain areas, removing the ashtrays or the butts that may be scattered all over the property to the extent that that's possible. If property is burned, you might want to have it replaced or updated or repaired. Sometimes changing the environment includes the installation of signage, information for people to see so they understand the new work that the agency may be going through. And, we have had this tradition of these smoke breaks in our treatment system for so long. It's a hard thing to undo. It's sort of a part of our culture. So I think an important piece is really thinking about that in a creative way so that you might begin over time to implement alternatives to the smoke break, alternative forms where people can have a break or a reward or something pleasurable as opposed to smoking cigarettes. So there's sort of lots of pieces here that you can think about. And again, you can be really creative and even have a work group thinking about some of these issues. Additional reasons for thinking about changing the environment is that we've heard many times from patients that they actually started smoking while they were receiving treatment at a behavioral health facility, whether it was a hospital or an outpatient program. Patients have told me this anecdotally. Even older people who never smoked their whole life, but smoked in a substance abuse program because they felt it allowed them to fit in with the group, to sort of do what everyone else was doing, to cope. People give you the message in program that this is how you recover, this is how you get better, this is how we socialize. If you're in the hospital, it may allow you to go outside. So we want to really think about, in terms of the environment in the broadest sense, again, the messages that we send to patients and the way we think about some of these behaviors that we've even developed in the treatment setting, and how we might want to change them over time, and how that might really support people who are trying to quit. Because remember, one of the key features here is that we're trying to make our treatments more effective. And we don't want people to feel like coming to the treatment program is the trigger. That's where the drug is. Treatment sites should feel like safe places where you can recover and practice your drug-free coping skills. And so again, changing the environment really supports that message. This is just an interesting new piece of information. And again, however this information appeals to your audience, I think it's okay to be clever and creative, but there's a lot of evidence that cigarette butts are an environmental issue. They're quite toxic to the environment, and perhaps that would mobilize people to want to become involved in this effort. 65% of smokers actually throw their cigarette butts on the ground and essentially litter. Cigarette filters are made from cellulose acetate, a plastic that only degrades under severe biological circumstances, which mean cigarette butts lay on the ground for a long time. They don't really biodegrade. They impact the environment, and they're ugly to look at. So again, this could really be a collective thing that an agency thinks about, just in terms of making the program perhaps a little nicer, as well as removing this really important cue to smoking and drug use. So sometimes I think a program will struggle with this idea. Should we have a designated smoking area versus being completely tobacco free? I can understand that that can be complicated at times, that there's different factors, and that there can be sort of pros and cons for which way to approach this. In some places, it may seem like a safety issue. If people were to leave the property, there could be safety issues about that are very concerning. Say if the program's on a highway and it's just not feasible for people to leave the property to walk somewhere else to smoke, that could be an issue. Sometimes there's concern that if people are leaving the property to smoke, they're sort of disturbing the neighbors. And that's sometimes a concern. And it sort of feels like a compassionate thing to do, to give people this place where they can do this. On the other hand, it really is continuing to allow the behavior and sort of enabling the ongoing use of this addicting substance. It really doesn't take enough steps towards changing the culture. We talked about how the litter here is quite dirty, bad for the environment. Sometimes the employees are unhappy when people are smoking outside of their window because the smoke comes in and there's exposure then to secondhand smoke. Certainly it's a cue and a trigger for anyone trying to quit. It can be really difficult to have to walk through a group of smokers to go to a treatment program, especially if they're right by the front door. You know, that is the picture of your program to the community. It may not send the most positive message of recovery. And certainly it leaves the drug available on site, not doing enough perhaps to reduce exposure. Again, I think this is where it's fun and you can get creative, because anytime we can create alternatives to people, it can be more motivating. They can have more incentives. So we want to incentivize behavior. This is never about punishing or taking things away, but can we create alternatives to smoke breaks, like a meditation spot, or a quick game of cards, or pick up basketball? Can we have snacks? Is there anything that we can do to give people an alternative to smoking? It doesn't have to be expensive. It is going to probably be a little bit more work by the staff, but it seems really worth it in terms of helping to shape and change the culture. One of the common mistakes in any kind of organizational change initiative can be that people don't understand the meaning behind why are we changing? What's the relevance? Why are we going through all this work? Is this really worth it? And so if you are going to have this kind of tobacco policy or environmental change, and you're really thinking about it at the organizational level, it can be really smart to try and tie in the message to other things that you may already be promoting, or your overall marketing and business strategy, so that it seems like very consistent with what you're already doing. It creates clarity in people's minds. There's less confusion about why the effort is moving forward. And it really sort of can be a positive, like this is going to make this a better place. So maybe not every program in our neighborhood is offering this innovative tobacco treatment and taking additional steps to change the environment of care to support treatment, but we're really the innovators here. We're providing the optimal care. This is a better place to receive services. So to really, again, spin in a positive way that this is a really great initiative that the agency is undertaking. So these are just some examples, again, of changing the message. We want to provide as much information and education to help counter the effects of the tobacco industry, which is quite good at their marketing. And there's, of course, a lot of misinformation out there about cigarettes, about other tobacco products like hookah and chewing tobacco, about e-cigarettes. So if we can counter that false information with good education, that can be really helpful. And you can imagine if you have signs and posters up, it really helps to disseminate the message to everyone and have a broader reach. These are just examples of posters that were created by the Truth Campaign, which you can find these online. They're a non-for-profit. They create many kinds of tools, and they sort of specialize in this kind of messaging. So for example, people don't know that hookah smoking is quite dangerous. That in fact, when you smoke hookah, the smoke is diluted through a water pipe, which allows you to take in a tremendous amount of smoke in a single evening. So that if you measure someone's carbon monoxide level, it's really the equivalent of several packs of cigarettes. So it's not a trivial smoke exposure that comes from even a single night of hookah smoking. So it's a really effective infographic you can see here that helps to get that information out. On the other slide, you can see that we now know that people with mental illness and addiction really are a huge percentage of the remaining smokers in this country, and they make up a lot of the market in terms of who buys the cigarettes. So again, that kind of a message, maybe we're being exploited by the tobacco industry. Our population is the bulk of people who buy tobacco in this country, and maybe we want to do something about that. There's always power in information. Similarly, we know that these are actually from the tobacco industry. These are real cigarette campaigns that happened, I think, in the 90s, really targeting African Americans in different urban communities, including cigarettes and giveaways at rap and other events. So you can imagine these are quite powerful and have had a very negative impact on the community. We know that African Americans typically smoke menthol cigarette brands in high percentages. And unfortunately, menthol cigarettes are probably even worse than non-menthol brands in several ways. They may be more addicting than non-menthol brands. Remember, what menthol does is it actually cools the airway, and it probably changes the way you take smoke into your body. That may allow people to take in more smoke per cigarette, which also means more toxin per cigarette, because we know that African American populations, even though they smoke fewer cigarettes per day, tend to get more diseases and have more difficulty quitting. And so there's a lot of information that supports this idea that menthol cigarette smoking may be a factor in this. So while there are policy initiatives underway that the government is debating about banning flavors, including menthol, they have not yet really gone into practice. So they're not being enacted today. And we need to give the public information. So this is an example of a counter advertising ad to try and educate people that menthol is actually a very deadly way to smoke cigarettes. And really the play on words here, how cool is that? Because of course the brand is called Cool. So there's lots of examples of things like this. You can certainly create your own tools, and I'll show you some that we've created, but many of these are available on the internet and are free and are easy to use. So again, the tobacco industry marketing message, right, of strength, masculinity associated with tobacco, the classic cowboy, the American image of the Marlboro smoker, and then how do we counter that message to be equally powerful, hopefully, and really show what happens, which is that secondhand smoke kills. So any examples we can do to counter the message is what we're striving for. Until recently, there have not been tailored messages for behavioral health populations. There are some now, which is really helpful, because when you have a tailored message, it can really help to reach these hard to reach populations. So this was a really clever example that friends of mine developed in Montana, where the message is, I didn't survive depression and suicide attempts only to die from lung cancer. I had to stop smoking. So again, helping people recognize, your life may be hard, you have mental illness, you have struggles, but you don't have to die from tobacco. There are options, you can have treatment, etc. And it's really consistent, of course, with everything else we do in the area of wellness and recovery. The CDC now has some tailored information and messages for behavioral health populations. They have a campaign every year where they videotape real smokers, tips from former smokers, and you may have seen some of these on TV. There's television ads that show Rebecca's story, and Rebecca talks about that she had depression, but she was able to quit smoking, and you can do it too. So these can be kind of inspirational, but also resonate with populations with behavioral health problems. So we have developed some tools that you may use, signs and handouts, things that you can hang in your program, again, that support this idea that it's a smoke-free property or tobacco-free campus, including e-cigarettes. No vaping pot here either. So just examples that you may or may not find helpful, so that it's sort of easy for you to click and print these and have an easy tool to hang in your environment as you begin to think about making changes. And we have several examples of these. And again, you might decide to write your own language I like when programs sometimes say that they're working to be tobacco-free. This can be something that takes time, and a program could be sort of planning changes over a period of 1 or 2 years. And I think it's really nice to even say, you know, we're working to be tobacco-free. We're sort of in transition, and I think that's a nice thing to put on signs as well, again, supporting the overall initiative. These signs I really like because we think about these in terms of what the clinician can do. So as I'm trying to talk to a patient, do an assessment, ask them about mental health symptoms, ask them about substance abuse, ask them about tobacco. Wouldn't it be nice if there was just sort of a poster right behind me to remind them and to remind me that really tobacco is among our scope of services. It's one of the things that we do here. If you have questions, please ask me, I can help. So these are the kinds of things, again, that you could easily print, that are free, that are on our website. That really the clinician could even hang in their office as a way to begin the conversation, or to kind of support the overall mission that this is something now that's important at this agency and that we're working on. And again, we have several examples of these, and I hope that you'll find them helpful. And you'll notice they're not necessarily about quitting. We don't want to overemphasize the quitting message because that can feel really difficult for people. It can feel like unattainable or too big of a step. So let's talk about tobacco, a much more gentle step consistent with our motivational interviewing approaches. We care about your health, a very positive message, and hopefully engaging to your populations. This is just one that the city has actually produced, very nice, to remind people that their Medicaid benefits cover this treatment so that they don't have to go to the store and purchase patches or other nicotine replacement at a high out-of-pocket cost. Ask your doctor for help. If you get a prescription, they're free in New York with Medicaid. So again, changing the culture, changing the environment, letting people know about the resources that are available to them. Just in terms of education that you may provide in different clinical settings, or even maybe in the waiting room, I think there's probably thousands of examples of different educational resources which exist about tobacco. Many will be aimed at the general public, but often they will be fine for the populations that we serve. You may be able to find some, and we have some that have been developed specifically for behavioral health audiences, but hopefully that won't be difficult in terms of including pamphlets, brochures, whatever you think would be helpful, handouts. I'm a big believer in handouts, making the information real and concrete. You know, I sure hope we go back to face-to-face treatment someday, where you actually sit in the room with somebody and you have physical tools like handouts, because I think that that can be really grounding for people and make it very real and less abstract. The psychoeducation groups in the Learning About Healthy Living manual you may already be familiar with, but that's another tool for providing educational resources that you can, even if you don't provide the whole group treatment, you could use the handouts in that book as other educational tools. And then, of course, how can we mobilize all of our electronic resources? How can we use the internet as a way to disseminate messages and send things to people? And even within our systems, how can we teach each other? How can we make sure all of our staff are on board? Do they have the up-to-date information about electronic cigarettes? So it's not only education to the people we serve, but also to our peers, professionals, and everyone in our organization. We've developed a lot of these clinical tools for working with patients. This is just a set of handouts that we developed. They're each one page, and they give straightforward instructions and information about how to use the tobacco treatment medications effectively. So this can be a great tool as you're teaching people, for example, how they might want to use the gum slowly, sort of the bite and park technique, to chew the gum slowly, to try and release the nicotine into the mouth slowly, to provide the greatest absorption of the nicotine through the lining of the cheek. As you're explaining that to somebody, it's always great to have a handout, a tool, something that reinforces that information. The person could take it with them after the session, use it as a reminder when they're at home if they have questions. And we were fortunate to be able to also have these handouts translated into many languages, not only Spanish, but Chinese, Russian, et cetera. You can see all the languages that are listed on the bottom of the slide, and these are all available on our website. Of course, our website is a huge resource in terms of tools and educational materials. So nearly everything I'm showing you today is available at our website. It is being reworked, but for now, you'll be able to find those things on the resources tab. In addition to the ones we've developed, there's just so many things out there. We can also help you to find these and provide these for you. Several of these are also on our website because they're in the public domain. But many organizations now, including CDC and SAMHSA, have also made educational tools on this issue of tobacco and mental illness. Some of them may be appropriate for clients that you serve, but these are also great tools for educating your staff, having a brief in-service training to review a topic, because they're well done and we know that the information on these is correct. Again, electronic communications will probably continue to dominate in the future. Can we send information through email or through listservs to people we serve or to our community? Do we have a website where we can post information? Do we produce e-newsletters? Newsletters can be particularly nice in not only disseminating information, but also spreading messages of hope, which is another way of communicating with your stakeholders and changing the environment, showing people's stories, perhaps, who have succeeded in quitting and highlighting that good work and achievement, again, towards greater culture change. Can we be sending information routinely to employees by linking the information through our HR systems to other communications that we may send out to employees? Can we host webinars or conference calls, again, for the purposes of disseminating information and spreading education? Maybe our agency's on Twitter and we put a posting on social media to highlight what we're doing. And there are many of these tobacco-free days that we can have an event at our site to also sort of highlight the work that we're doing, whether it's World No Tobacco Day, which recently happened in May, the Great American Smokeout, which is in November, and Kick Butts Day in March. So many examples and ways to think about getting information out and communicating better with our groups. In the city, there's of course so many resources. You have resources both at the level of the city and the state. This is the website that is produced by the city's tobacco control program. It has the telephone number for the quit line, which is 866-NY-QUITS, and is really a nicely done website in terms of easy to find information that's up to date, accurate, and can be really helpful to people who want more information. So I talked about a lot of different ideas today, and I would be interested to hear your ideas on some of this, maybe some of the creative things you've done in this area, as well as to answer any questions you may have on changing the environment, as well as making policy changes. So thank you so much for your attention. And I think we're going to stop for questions. You're welcome to put your questions into the chat box, or you may unmute yourself and ask them out loud, whichever you prefer.
Joe, can they throw in some ideas on what they would do in their environment to?
Absolutely.
Yeah.
I would love to hear that.
I have one suggestion. We got this from SUS, but you can get the people you serve can get involved and will come up with ideas too, and they're pretty creative on this.
I think that's a great suggestion. I have heard of programs that have had poster making contests where clients may make posters and there's a competition with a prize, or I think even just having input from different stakeholder groups, including the patients you serve, is really a great idea. So there is a question in the chat box. How can we discourage people from smoking near our residential entrance? I think that that's a common problem. And it's going to take, probably a team of people and perhaps a policy change and support from leadership. So I guess the first thing that I would do is, if you have a work group that's talking about this issue, is sort of discuss it openly. And think about the pros and cons of that. And if the agency wants to move forward, it's probably best to make a formal policy change, however you want to do that. I think informally, just telling people to leave every day is not going to be very effective. I've seen places do things like paint a box on the sidewalk, like a big yellow box within 25 feet, and no one's allowed to smoke sort of within the box. That would be one example of something you could do. You could certainly move it to another area where it's more discreet, not the front door of the program that's sort of the welcome to the community and that everyone has to walk past. But again, each place is going to have specific issues and geography and culture, and probably want to handle it differently. So I don't think it's a one size fits all approach. But by having a work group, people could really discuss it and maybe come up with some interesting and creative solutions for how to go about it. I think it's really helpful if you could get administrative support and buy-in to move it forward once there's sort of consensus on how you want to do that. And I think that, again, this idea of including the people you serve in this kind of discussion can be really helpful and in fact, make it more powerful. I have found that when programs begin to implement a lot of these tobacco treatments and changes, often the patients start to bring this up. Why are we still letting people smoke by the front door if we're all working so hard to try and quit? That's a trigger for me. And so I think really harnessing that voice and that patient perspective in an advocacy way can not only be helpful in moving the initiative forward, but really empowering for people that they're having input into the program in a meaningful way. So I think it's a really important conversation to have, and let us know how it goes. Any remaining questions or comments on anything we talked about today? Creative solutions, things that your agency is considering in this area? Okay, if not, we will conclude, and I really appreciate your participation and attendance today, and I hope this was a helpful webinar session for you.